Welcome back to Mind, Health, and You. Today we're diving into a fascinating and often misunderstood topic. How does our trauma affect our sexy kinks? We all know that our past experiences shape who we are. But what many people don't realize is that trauma can also influence our desires, fantasies, and even what turns us on. This doesn't mean trauma is always the cause of kinks, but for some, there is a powerful connection. Let's unpack this together. What are kinks? First, let's define what we mean by kinks. Kinks are sexual interests, preferences, or behaviors that go beyond what we usually think of as mainstream sex. This can include things like role play, BDSM, power dynamics, fetishes, or even certain emotional themes in intimacy. Having kinks doesn't automatically mean something is wrong with you. In fact, many people explore them as part of a healthy, consensual sex life. But sometimes, the roots of these desires can be traced back to earlier emotional wounds. Trauma and the brain. So how does trauma come into play? When someone experiences trauma, like abuse, neglect, rejection, or even intense emotional pain, the brain adapts in unique ways. Trauma leaves deep imprints on our nervous system, shaping how we perceive safety, control, and intimacy. For example, a person who once felt powerless in a traumatic situation might later develop a kink where they reclaim power through dominance. On the flip side, someone might find comfort in submission because it allows them to let go of control in a safe, consensual environment. Essentially, trauma can create emotional blueprints that show up in our sexuality, sometimes in surprising ways. Healing through kinks. Here's something really important. Kinks are not always negative. In fact, for some people, they can be a path to healing. Consensual roleplay and kink can provide a safe space to rewrite old narratives. Imagine someone who grew up feeling unheard or neglected. Through roleplay, they might create a scenario where they are fully seen, desired, and in control. This can feel empowering and therapeutic, almost like the brain gets a chance to re-experience those emotions in a healthier, safer way. When trauma shows up unhealthy. Of course, not all connections between trauma and kinks are positive. Sometimes, unresolved trauma can lead to compulsive behaviors or patterns that feel harmful rather than healing. For example, someone may feel stuck repeating painful dynamics in their sexual life because it mirrors their trauma. If kinks are causing distress, shame, or problems in relationships, that may be a sign to explore them more deeply with a therapist who understands trauma and sexuality. Removing the shame. One of the biggest challenges people face is shame. Society often judges kinks harshly, and when trauma is involved, people may feel broken or damaged. But the truth is, there's nothing shameful about having kinks. They are simply part of how our brains and bodies process desire. By approaching them with curiosity, compassion, and communication, we can create more self-awareness and healthier intimacy. So, how does trauma affect our sexy kinks? Sometimes trauma influences them directly. Sometimes it doesn't, but when it does, it can be both a challenge and an opportunity for healing. If you found this video insightful, don't forget to subscribe to Mind, Health, and You for more deep dives into mental health and sexuality. And remember, your desires don't define your worth.